Rehab program, Achilles tendon ruptures. Mechanism of injury. The Achilles typically tears when there's a sudden increase in stress on the Achilles tendon. This is often caused by repetitive jumping and sprinting movements. People with Achilles tendonitis are at higher risk. Here's a video explaining Achilles tendon ruptures.
The Achilles tendon, also known as the calcaneal tendon, is the largest tendon in the body. It is a strong, thick tendon that connects the calf muscles to the heel. It is involved in pointing the foot downwards away from the leg, or plantar flexion. It is important in keeping the ankle stable when you walk, run, jump, or tiptoe. Sudden acceleration, deceleration, forced twisting or jerking of the foot, and sometimes overuse of the tendon can cause the Achilles tendon to rupture. 80% of ruptures occur during recreational sports. The tendon can be partially torn or completely ruptured, resulting in a snap sound. When a rupture occurs, a common presenting complaint will be weakness with push-off. A doctor can often feel the gap in the Achilles tendon by running their finger along the patient's ankle. An Achilles tendon rupture can be confirmed by an MRI or ultrasound. The treatment can be non-operative or through surgical interventions. A rupture can take up to 12 to 16 weeks to heal after surgery. Athletes typically return to sports after 3 to 6 months. You can learn more about the human body with complete anatomy.
Achilles tendon rupture surgery. Often another tendon, sometimes from the foot, can be used as a graft for the Achilles. During the surgery, they must remove any bone fragments found. The surgery is optional and it's not always necessary. The rehab process is long with or without surgery. Mechanism of rupture. This chart can help you understand what athletes are at risk for Achilles tendon ruptures. Athletes in running sports have a much higher risk of Achilles tendon injuries. About 75% of the total and majority of partial tendon ruptures are related to sports activities that include repetitive jumping and sprinting movements. Non-sports injuries make up 32% of Achilles tendon ruptures, as well as basketball, which also makes up 32%. Football makes up 8%, tennis makes up 9%, racquetball makes up 4%, soccer and squash both make up 2%. Volleyball makes up 3% of Achilles tendon ruptures, and other sports make up the other 8% of Achilles tendon ruptures. Early rehab program exercises. During week 0 to 3, you can do toe curls, toe spreads, gentle foot movements in the boot, straight leg raises, and knee flexion and extension. With your healthy leg, you can do cycling, weight training, and swimming for cardiovascular activity. During weeks 3 to 8, you can do straight leg raises, side lying hip abduction, straight leg bridges. You can also do some isometrics with the uninvolved muscles. Light active dorsiflexion of the ankle until gentle stretch of the Achilles after 4 weeks. Slowly increase the intensity and ranges of isometrics of the Achilles within the range of the boot. Slowly increase passive range of motion and stretch on the Achilles after 6 weeks. Proprioception exercises, intrinsic muscle strengthening, and PNF patterns for the hip and knee are also exercises done during weeks 3 to 8. At 6 weeks, it's okay to add stationary cycling, but only push with the heel on the pedal and not your toes. During weeks 8 to 12, you can begin to gradually increase active and resistive exercises of the Achilles. You can also progress to cycling in a shoe and swimming without fins. Late rehab program exercises. During months 3 to 6, you can begin controlled squats, lunges, and bilateral calf raises. You can also progress to unilateral calf raises. You can also do some toe raises. You can also gradually introduce cycling, VersaClimber, rowing machine, and NordiTrack into your program. Unless excessive fibrosis is present, your patient should be discharged into a home program while still checking in with their physical therapist. At month 6, you can progress to training with jogging and running. You can also do jumping and eccentric loading exercises. Non-competitive sporting activities and sports-stimulated exercises will also begin during month 6. At around month 9, you can begin to return to physically demanding sport and work, but the return to play protocol can take a long time depending on the person. Return to play protocol. For the best outcomes, the Achilles tendon repair is typically performed within 2 weeks of the injury. Recovery takes between 6 to 9 months. Return to play can take between 9 to 12 months depending on the severity of the injury. Achilles tendon tears can be successfully treated without surgery, but often, with or without surgery, it takes a year to fully recover. Before people can return to recreational sports, an injury also often has a significant effect on a person's finances and their personal life. Rehab timeline. During week 0 to 3, you can have an adjustable boot locked out at 30 degrees of plantar flexion. You'll be non-weight bearing and you'll focus on pain control. At weeks 3 to 8, you'll begin walking orthosis set at 30 degrees plantar flexion. At 3 weeks, adjust 10 degrees per week and to gradually increase your weight bearing. Weeks 8 to 12, you can wear normal shoes with a heel lift and works towards not wearing a heel lift. During months 3 to 6, you can begin sports drills. At month 6, you can begin sports practice, and at month 9, hopefully you will be ready to return to play. For the best results, Achilles tendon repair is performed within 2 weeks after the injury, and recovery takes 6 to 9 months. Return to play can take up to 9 to 12 months depending on the severity of the injury and the sport which the patient wants to play. Re-injury prevention. Avoid activities that put too much strain on your Achilles tendon, such as hill running and jumping. Choose your running surfaces carefully. Avoid or limit running on hard or slippery surfaces. Dress appropriately for cold weather and exercise well-fitted athletic shoes with an adequate heel. Conclusion. Achilles' heel is a famous warrior with a famous weak point. This is the same weak point as many pro athletes because Achilles tendon ruptures can drastically affect many pro athletes. The rehab process for an Achilles tendon rupture is very long. Here are my sources. Thanks for watching. Any questions?